for coming. Hi, my name is Mason Matos, and today I'll be presenting my senior project for you. So, in order to figure out what I wanted to do for my senior project, I did some research, and at first I wanted to do something very easy so I could just get it over with and be done. But then my mother persuaded me to actually do something that I was passionate about. So I decided to look into physical therapy as my project, and there was already a template for the actual project in the rubric for senior project. So I used that template to make my project, and I created a hypothetical patient and created a recovery plan for the patient. So to begin my project, I had to find a project facilitator who was willing to spend long hours with me and teach me. Because physical therapists have to go to school for at least 7 to 8 years, and I did not have 7 to 8 years to do this project. So I had to find someone who was willing to teach me the basics of the actual project. So I found Jennifer, and she works where my mother works, she works in Windy Hill. My mother helped me find her, helped me connect with her and conversate with her and talk on the phone with her and all that kind of stuff. And before I even began my project, I did some research on actual physical therapists, and I learned just some things about them and how long you have to go to school and things of that nature. Me and my project facilitator had a few conversations before we met in person. We did FaceTime, and we talked on the phone, and I asked her a lot of questions about her education and what she did to become a physical therapist. This is the actual facility that I went to shadow her. This is Windy Hill Hospital. This is one of the wings that I went to. The patients' rooms are on either side. When I was with her, I learned a lot. I got to watch her with other patients, and I got to observe her. And it was very, very interesting seeing her work with other patients, because that helped me actually do my project and create a recovery plan for my hypothetical patient. This is one of the outpatient facilities that I got to see. I only got to see a few patients work there because my project facilitator is a physical therapist for inpatient patients. This is me and our project facilitator. That's just me working on it. And I did work on it with her in the hospital on lunch breaks, and she did help me actually create my patient and create a recovery plan for them. There were two patients that stood out to me the most when I went to shadow her. One of them had a amputee on one of his legs below the knee, and it was very interesting to see that because he was a diabetic patient who did not take proper care of himself. So it showed me that because I'm diabetic, I need to take care of myself, and physical therapy cannot always be the end goal when you have an injury or any of that going on in your life, because it cannot rehabilitate you 100% if you do have a spinal injury or a leg injury, and you'll never go back to normal, but physical therapy can help you in some ways. And the next patient was a young male in his 20s. He had a brain injury from a motorcycle accident, and it was very sad to see because he was in such a state where he couldn't remember anything. He didn't really know what was going on around him, and he wasn't really speaking. He was mumbling. He kind of sounded like a baby, and it was really sad to see his mother go through something like that. This is actually my product. My product was based on a recovery plan, as I said earlier. I did my product on a hypothetical patient who we called Jane Doe, and that is what hospitals call their patients when they cannot identify them. She's a 30-year-old female, and she was healthy all of her life until she got into a car accident, and a drunken driver hit her. When she got to the hospital, she had a few lacerations. She had a laceration on her arm and bruises on her body, and they treated her in the emergency room. Then they took her to an MRI because she was complaining of not being able to move her toes. So they took her to the MRI, and they found out that her T10 was damaged, so she could not feel anything below her abdomen. Her legs were not able to move. She could not move them, so they were not functionable. They were not usable. This part of my product is just going through what the different services did for her. So respiratory team saw that she had no trouble breathing. She didn't need a trachea or any of that. Medicine was given to her. She had neuromedication to address the neuro impulses sent to her muscles and medication to address muscle tone. A catheter was placed because of course, she could not walk to use the restroom because her legs did not work. Nurses were told to shift her, and wound care was told to treat her bed sores because if you lay on bed for a long time, you will get bed sores. And I did see someone in the hospital with a bed sore, and it was really gross and really painful. So the nurse was told to shift her to make sure that doesn't happen. And the dietitian did give her a plan of meals every single day, and like breakfast, lunch, and dinner, and probably snacks too, because she needs to regain her strength. So the first thing that a physical therapist does is has a consultation with the new patient that just came in. And once you get the consultation, you start to see exactly what the patient needs and how strong they are. So in this case, she was pretty strong because she was young, so she had pretty good core and arm strength. So in this case, it would just be helping her get stronger to lift herself up without the use of her legs. The first thing that you do is patient education after the consultation. You have to teach them how to move their legs and arms, not move their legs, move their legs with their arms to get out of the bed and onto the wheelchair. Transfer from the bed to the wheelchair because that is very hard when you only have your arms to help you move. And practice using the wheelchair on wide hallways, narrow hallways, and ramps, curves, things that she'd encounter when she's out in the world. Next thing is exercises. Arms and core are very, very important. So of course she's going to have to do arm exercises. She's going to have to learn how to sit up on her own on the bed, and that takes a lot of core strength. And being able to sit up on the bed with distractions is very, very, very important. So that's something that we must stress as physical therapists to the patient, that she has to be able to get up on her own without any help from anyone else, because if she does want to live alone in the future, she's going to have to know how to do that. These are just some exercises for arms in depth, and I'm not going to go into true depth with them because of time, but these are just pictures of the different exercises that she would do. This one right here looks like it would be impossible for someone with no leg function to do, but with the help of nurses or other people around her, she would be able to do it. And this one would just be with her sitting on the actual bed. Those are just some core exercises, like sitting up on the bed with a distraction, without a distraction. With the distraction would be like throwing a ball with her and making sure that if anything is going on around her, she can still sit up on her own. Stretching is something that is probably the most important thing in this whole entire recovery plan, because if her legs are not flexible enough to get to the wheelchair, she will not actually be able to get into the wheelchair. So stretching the legs is something that she needs to do every single day, multiple times a day. And these pictures are just some things that she needs to do. And arm stretches are included in the recovery plan. And then family education is also very important, and we just teach them how to cope and certain things to help. And we teach them about autonomic dyslexia, which is basically the impulses are stopped and patient gets high blood pressure, and it's very important that the family knows about this, that they can help the patient if they do have this. And then outpatient care is continued after they leave the hospital for 6 months to a year, depending on their recovery in the actual hospital. Now, throughout this project, I did have a few problems. I didn't know exactly what I wanted to do with this. I didn't know how to create my presentation, but my project facilitator did help me, and we figured out that Prezi would be the best way to do this. Now, in this time span of a year to 8 months, probably, In the beginning, I thought that I really, really wanted to do this as my career in the future, but I figured out throughout this process that it wasn't the best thing for me because it wasn't as interesting as I thought it was going to be, and I got a little bored after a few days of spending time in the hospital with patients because they were really weak. So I figured out that that's not what I want to do for my life, but I do want to do something in the medical field because I want to help people. And after high school, I will be attending EGA, so I'm really excited about that. Any questions?